The next exercise is a door stretch. The purpose of this exercise is to improve the flexibility in your chest muscles, also known as your pectoralis muscle. And when you improve the flexibility of this muscle, you will immediately improve the joint position of your shoulder, minimizing strain and impingement on the rotator cuff. When this muscle is tight and fixating your shoulder in a forward position, it will lead to increased strain in your neck. It will cause your upper back to become tight and in a known as a kyphotic posture, as well as cause your shoulder to work and function in a less optimal position, leading to pain. You perform this exercise by simply standing in a doorway, and while standing in the doorway, you'll place your hands about shoulder height on the doorpost. Place one foot out in front of you, the other foot or leg back, and in a lunging position you'll just lean into the stretch, feeling a stretch in the front of your chest area. Be careful not to strain or lean too hard into it, because it is putting strain on your rotator cuff. You should feel a comfortable, strong stretch in your chest. Do that exercise for 5 times on the one leg, and then switch legs and place the other foot in front of your body with the other foot back, and repeat. You can hold the stretch for 20 to 30 seconds. The next exercise, what we're going to show, is a thoracic extension mobility exercise over a foam roll. You can also do this exercise over a rolled up pillow. The goal of this exercise is to just improve your upper back spine mobility. Because we sit so much, we have this forward head and rounded shoulder position, and by doing this exercise you will improve your posture and help you stand up straighter and with your shoulder blades back. When this occurs, you immediately affect the quality of the movement of your shoulder, and thus reducing strain and impingement risk factors on the rotator cuff. To do this exercise, you will need a foam roll. You can position yourself over the foam roll, laying down with it. You can clasp your hands behind your neck or your head, pulling the elbows towards each other, holding them tightly tucked, and then for 5 to 10 repetitions you'll just gently extend yourself over the foam roll and bring yourself back into a forward flex position. You can start on the top of just at the base of your cervical spine, and work yourself 3 segments below, slowly rolling over the foam roll, working yourself up and down 5 to 10 times at 3 different levels. The next exercise we're going to look at is the bridge. This exercise is beneficial to improve your gluteal and hamstring strength. This is important because it indirectly affects the shoulder joint position. When you improve these muscle strength, you will improve your posture, and you'll have less of a thoracic kyphosis, and by so doing improve your shoulder strength. To perform this exercise, you lay down on the floor, arms to your side, preferably palms facing up. Relax your neck, your shoulders, and by breathing and relaxing, you will raise your buttocks up towards the ceiling with your feet and knees in a bent position, and then slowly lower yourself down. You will do this 20 to 30 times. You can also do this exercise by placing an elastic band around the knee or just above your knees. The elastic band needs to be fairly tight, and you'll keep your feet and your knees aligned and about hip width, and you'll do the same exact exercise, which is another variation to make it a little harder. The next exercise we're going to look at is arm slides against a wall. To do this exercise, you will just stand with your body up against the wall, trying to keep your head, shoulders, buttocks, and feet up against the wall, maintaining good posture. You'll try and bring your upper arm up against the wall while trying to get your forearms back against the wall as close as you can. If you have shoulder pain, just bring your arms back as far as you can, externally rotating your shoulder to the best of your ability. From about 45 degrees of abduction, in other words, where your arms are raised away from your body, you will just slowly, while maintaining contact with the wall, slide your arms up and down, maintaining a 90-degree angle in your elbow joint. Do this exercise for 10 to 20 repetitions.